Hello everyone, welcome to my YouTube channel Natural Living. Today's topic of discussion is a vitamin that 73% of the world's population is low in, but still it's the most underestimated vitamin. My name is Sheetal, a health practitioner, and in this video I'm going to elaborate on the health benefits, risk factors and dosage of this pro-hormone called as vitamin D. Vitamin D is also called as sunshine vitamin due to solar UV radiation being its preliminary source. The cholesterol present in the layer of the skin convert the UV radiations into vitamin D, which is then taken to the liver. From the liver, the vitamin D is converted into an active form called as calcitrol in the kidneys. It's then moved to the intestines where it helps with calcium absorption and also taken to other cells of the body where it enhances the functioning of different organs. So what are the deficiency symptoms of vitamin D? Number one would be joint and muscle pain. You can experience morning stiffness or just stiffness of the joints, including arthritis and osteoporosis. You can also experience pain in the breastbone or the sternum and the shin of your legs. Low immunity is a key indicator of vitamin D deficiency. That's because every cell of your body has VDR, or also called as vitamin D receptors, which is a part of your immune system. You may be prone to various upper respiratory tract infections and cold and flu. Fatigue or tiredness is one of the other symptoms that you can experience with low vitamin D. You can experience excessive sleepiness during daytime and insomnia at night, making you feel tired throughout the day. Depression or winter blues is a key indicator of vitamin D deficiency. That's because vitamin D regulates the neurotransmitters like dopamine and serotonin, which are also called as the happy hormones. So if you feel low during winters, this could be a key indicator of this vitamin deficiency. Weight gain is also linked to low vitamin D. So if you're wondering why you are finding it hard to lose that extra pound from your waist, it could be linked to vitamin D deficiency. Doesn't matter what you do, unless you don't fix the deficiency symptom, it will be hard for you to lose weight. But apart from that, it's found that people who are overweight or obese are generally low in vitamin D and may need excessive dose to correct the deficiency. Benign paroxysmal positional vertigo, where your head starts spinning when you raise from a sitting position, could be again a sign of vitamin D deficiency because this involves degeneration of the bones in your ears. In men, erectile dysfunction and low sperm count has been linked to vitamin D deficiency. Many autoimmune disorders are linked to vitamin D deficiency, like Hashimoto's thyroiditis, multiple sclerosis, and lupus. There are 30 different forms of cancers linked to vitamin D deficiency, like prostate, breast cancer, and pancreatic cancer. But apart from that, there are a lot of metabolic disorders like diabetes and thyroid linked to vitamin D deficiency. In my private practice, I haven't seen a single patient of mine with thyroid conditions who doesn't have a vitamin D deficiency. Though 90% of this vitamin is available from UVB radiations, we find that more than half of the world's population is low in this vitamin. So if you think that standing outside in the sun for about 15 to 20 minutes gives you enough of vitamin D for the day, you need to listen to the risk factors that I'm going to talk about now. The absorption of vitamin D depends on various factors like location, the time of the day, and the weather. It's very important to know the factors that block these UVB radiations. The ozone layer of the earth blocks the UVB radiations by 90% and only 10% reaches the earth's surface. This is enough for vitamin D formation. but the pollution blocks these UV radiations further. And this probably explains why people in sunnier countries are still low in vitamin D. The sunscreens with a minimum SPF of 15 blocks UV radiations by 99%. So this means if you're out exposing yourself in the sun on a beautiful sunny day with sunscreen on, you produce no vitamin D at all. So if you think that driving on your way to work with windscreen on or enjoying a cup of tea in front of a window on a sunny day gives you enough of vitamin D, then you are wrong again, because the windscreen blocks the UVB radiations and allows the UVA radiations to pass through, which is more damaging to the skin. And since the UVB radiations are blocked, you don't form any vitamin D. The other risk factors include clothing and cloud, which again blocks the UVB radiations. Dark-skinned people, particularly those modestly dressed, can be low in vitamin D. The dark skin has more melanin, which is a pigment that blocks the UVB radiations. So fair-skinned people probably may need only 15 to 20 minute exposure to the sun on a sunny day, whereas people with dark skin may have to stay in the sun for about a couple of hours to form the same amount of vitamin D. Housebound, community dwelling, older or disabled people, those in residential care, and those who regularly avoid sun exposure or work indoors are at a high risk of vitamin D deficiency. Conditions that reduce fat absorption like celiac, inflammatory bowel disease, and cystic fibrosis are some of the risk factors involving vitamin D deficiency. Pregnant women who are found to be vitamin D deficient are at an increased risk of C-section because this particular vitamin helps with muscular contraction and relaxation. Infants born to these deficient mothers have a high chance of developing rickets and bone diseases. So if you think that you are experiencing one of these symptoms or you fall under one of these risk factors, it's important to get your vitamin D assessed, and this is through a blood test. Vitamin D is best assessed while measuring serum 25 OHD levels. Levels of vitamin D, which indicate deficiency and excess, vary between sources. So as you see here, less than 50 is deficiency, levels between 50 to 80 is insufficiency, 135 to 225 is normal in sunny countries, 250 is excess, and more than 325 is intoxication. So what are the best sources of vitamin D? 90% of vitamin D can be obtained from the sun. So it's important to expose at least 15 to 20% of your body surface area to those UVB radiations anywhere between 11 a.m. to 3 p.m. when the UV index is high. But this may be not applicable for certain people who have a high risk of skin cancer. So can your body produce excessive vitamin D from the sun? Definitely not. Recent studies have shown that the maximum vitamin D that your body can produce is somewhere between 10,000 IU to 20,000 IU, and your requirement is up to 1,000 IU a day. Vitamin D can also be obtained from certain foods like oily fish. These include sardines and salmon. Apart from that, mushroom, cheese, butter, lard could be good sources of vitamin D as well. Liver, specifically cod liver, has vitamin D up to 400 IU. But the food sources are very limited when it comes to vitamin D, and 90% comes from sunlight. So friends, if you think that you are vitamin D deficient, please get your blood levels checked, and in consultation with a doctor, you need to up your vitamin D levels. Prevention is always better than cure, and this saying goes very well for vitamin D because this hormone controls many metabolic functions in your body. It can prevent many forms of cancer and autoimmune disorders. So please take vitamin D seriously, and if supplementation is required, you need to go for them. If you like this video, please don't forget to like, share, and subscribe. Thank you.